with this we come to the next part, that is the third segment of this 4-part series, and the topic is comorbidities and complications of sleep disorders. To begin with, what conditions are commonly associated with the sleep disorders?
See, the obesity is one of the most common thing that is usually associated with the sleep apnea and the snoring. That when the patient is, for point of view, snoring will be there. Then sleep apnea. Sleep apnea is a medical diagnosis basically. Next is when a person is getting sleep snoring or sleep apnea, means they'll be overweight, and they'll be having diabetes, hypertension, this dyslipidemia, this high cholesterol and the triglyceride, and most of them will be having a fatty liver also. So this is it is actually the when the sleep is affected, that this diabetes and hypertension also getting even affected, it will be again increased. So it will be mutually supplementing. Actually, the lack of sleep is creating the problem, and this diseases again increases the sleep problem. And again, the medication which is used for this the treatment also will be actually aggregating the sleep problem, because you are taking night, you will be taking so many medicines and going for sleep because of the acidity and regurgitation, or this gastroesophageal reflux GERD syndrome and all, your sleep will be again further disturbed.
Actually, when we talk about these comorbidities like diabetes and hypertension and dyslipidemia and all that, sometimes we think whether actually a sleep disorder can cause any of these disorders, whether sleep disorder can in any way influence the development of, say, hypertension, or say diabetes, or say dyslipidemia, or say some organ disease like some liver problem or kidney problem, or for that matter any of these. Can actually a sleep disorder lead to that?
See, most of the diseases comes from this, especially the lifestyle diseases. The sleep disorder will be definitely related with some other. Sleep is restlessness or excessive sleep is a symptom. Actually, it doesn't have any independent existence. Just like pain. If you have pain, there may be a problem to creating the pain. So pain is a protective mechanism to protect the body. It's our immune system is telling you that there is a problem, a pain is there, and look into that. And if you have sleeplessness, you should take it as a symptom. There is some problem with your brain. If you don't have any pain, sometimes because of the pain you are not able to sleep. If you have arthritis, you can't even move. When you are moving, your shoulder may be paining, you won't be able to get a sleep. Or when your breathing problem, sleep apnea, you are not getting oxygen, then you are getting or nasal block, allergy or asthma. This all can produce sleeplessness. And even restless leg syndrome, then the circulation into the leg is not proper. Even this GERD syndrome, that is this gastroesophageal reflux, this fluid is coming up from the stomach and irritating the air passages. So all these things can affect your sleep. And also, when the sleep is not there, the whole next day you will be very uncomfortable. You get anxiety, depression, and you won't be able to concentrate. If you are not able to concentrate in your job, you will be stressed again. So it's a vicious cycle which is increasing in each level. The disease will be increasing in that way, and the sleeplessness and the mental problems. It is not only, it's a mental and the physical. Both way it will be affected.
See, you mentioned that in the mental as well as physical way, sleep disorders can affect the person. In the physical way, it is heard that even aging, excessive aging, can be a result of sleep disorder. Similarly, the person's body can have excessive inflammation, and his metabolic process may be affected if there is a sleep disorder. So what we understand is sleep, as you said, though it's a symptom, it starts affecting almost the whole body in all different ways. So in such a condition, what is the possibility of intervening, or what is the way in which the patient or his support group can orient the treatment for such a situation?
See, the immune system is actually the defender and the healer. Actually, immune system is the inflammatory part is active in when you are awake. And the healing part, that is anti-inflammatory part, is active during the night. That is the repair activities is happening. If you are not able to have a proper sleep, your inflammation will go high and the repair and anti-inflammation will go low. So most of these diseases, almost all the diseases, the problem is with the inflammation. If you are not able to sleep or getting mental disease, anxiety, that means your brain is inflamed. If your joint is inflamed, you get the joint pain. Their pain sensors are there. So if you are arthritis, the pain is the major problem. Because the joints are very plenty of pain sensors are there. Or if you have a problem on the skin, you can get itching or the pain will be there. But for the brain, there is not much pain receptors. Only in the covering part there will be much of this. But when this peritone, this meninges and all is affected, you get the pain, headache and all. But in the internal brain matter, there will not be much brain senses, and then there is inflammation. You get all these psychiatric manifestations and sleeplessness and all. To overcome this sleep disturbance, you had to correct your lifestyle. This correct sleep hygiene, and also this food habits. This exercise pattern. All these things corrected, then only your sleep can be restored to the normal. And if you do all these things in the correct way, you can come out of other diseases also.
What is the long-term outlook for patients with sleep disorders?
See, the medication and surgery has a very minor role only in the management of this. Because if you take medicine, you have to take it lifelong, and you have to add on medicines, and you will be following the next day. If the usually this sleep induces, or when your sleeplessness, insomnia, you're not able to sleep, you will be given suppressant. The next day you will not be able to function properly. So actually brain is suppressing your brain. Your intellectual and cognitive function will be reduced. And also there is a chance for, if you are driving in the next day, the chance for accident and all is increasing. Not only driving, they are maybe operating, even the ladies who are operating on the kitchen machine like a mixer grinder, you can get into trouble if you are sleepy and you're using sedatives. So it's not a long-term solution at all. And also we have earlier discussed about the surgeries like this removing the adenoids, removing the tonsils, or the sort of removing the soft palate surgeries and all. It's also not giving a permanent solution, and you're actually removing. For the surgeries, actually, you cannot make even a cell or a part into. You can only add some plastic into the, put some plastic material or the metal into the body, or you can remove some tissue. But that is not a solution. Actually, when you are doing surgeries and doing such things, you are damaging even the respiratory tract is so delicate, and you're damaging that. So you should, as much as possible, you should avoid doing surgeries for this sleep problems or sleep apnea and all. And medication you can take for a short time. If you have a stressful situation, if you have a bad incident in your family or some death, you are not able to sleep, definitely you can take a tablet for a short. You can, very good medicines or combinations are there. You can get a very good dreamless sleep. You can be able to provide, but that should be useful only for few days. It should don't get addicted to that. If you are used to with a good sleeping pill or a combination of sleeping pill for a day or two, you will always, the body, just like tasty food, you will be always longing for the sleep. So there is a tendency for you to use that and get addicted to it. And finally, the same dose will not be sufficient. You will be increasing the dose and you cannot come out of this medication. So don't take it maximum 1 or 2 weeks or maximum 1 month. The most safest is actually the natural method itself, that is melatonin hormone. But that also you cannot take it for a long time. And it has some other advantage also. If that is effective and if you are able to put your sleep hygiene, that is going to sleep in the correct timing, and for say 10 o'clock you are going to sleep and you take the melatonin tablet, and within 10 days the sleep rhythm will be coming to normal. And definitely you should wake up in the correct time also, and don't sleep in the daytime. And if you are sleeping for taking this sort of, because it is not a drug actually, it's a natural, that also should be taken only for few days. If it is judiciously taken, I have in my experience, within 10 days itself the patient can come out. Sometimes it depends on the patient's nature. If those who are on a long-term this benzodiazepines or other sleep medicines, they may take it to a little more time, and then the patient comes come out of it, because if they don't have any problem, no one likes to take medicine. So they definitely, if the sleep is got corrected, they will come within 2 or 3 weeks, they will stop taking medicine. Next time, the doctor and I am not able to sleep okay, I am not taking it. That is the way. It's a SOS medicine only if you need it. That is only for the short time daily, and then it's occasionally. So that is okay. If you have you want to travel, even I am telling the patients who are coming from a distance from the hospital visit, the previous day they won't be able to sleep. But this tablet, it will not give you hangover like the other sleepy drug medicines. So if they want, they can take it. It will only give a 6 hours sleep or 8 hours sleep, and not more than that. So such a tips also it will be useful for the patient. But it's only medication is only short time. Even the hormones like melatonin, it should not be. You should not make it as a habit. I heard that in the Western countries there are even it can be added into the ice cream. So I don't know about it here. That is in India. I don't think such things cannot add into ice cream and all. I had heard that there are so many ice cream and other things, and it is off the label. You can get this melatonin tablet anywhere with ice cream and all. So that is not good. That is very harmful, because it is actually suppressing your own brain mechanisms. If you're taking everyday melatonin, then the melatonin secreting neurological brain cells will be atrophic, and finally you will be dependent on the outside melatonin. So even the hormones, you should not take it, you should not use it injudiciously, very carefully, and it's needed. But if you have a serious problem, you can have a very good sleep with these medicines. And after that, you should stop and you correct your lifestyle.
So, in case when we are talking about lifestyle correction, what is the role of lifestyle correction in managing sleep disorders in a holistic way?
See, in my experience, most of the patient complains of decreased sleep or increased sleep. They may be having, many will be having, even the diabetes patient, the most common sickness which we are coming across is diabetes, type 2 diabetes and hypertension and heart disease. And many of the patients say that they have sleep problem. And also they will be saying that initially they will not be saying. In the daytime they will be sleepy. If they get into the car, they will be sleepy. Or if you sit somewhere, that's doze off or sleep off. That will be the situation. And the patients say that now he's not, or the guardian will say, now he is not sleepy, he's sitting and enjoying the drive. Or usually he sits and when he or she sits and dozes off, but now there's no problem like that. So that is the result actually. If you are able to do the correct lifestyle, not only from this sleep disorder, you can come out of all your other lifestyle diseases like diabetes, hypertension, heart disease, and you can come out of that medication also. Actually, you get good sleep only if you're out of the medication. So that is very important. If you are going to sleep with the aspirin and copidogrel and all this acidity inducing, even the metformin, it's all acidity inducing and the gastric irritants. And many of this, if you read into the details of the side effects and the problems, even most of the this hypertension medicines, it is having one of the complication is the lack of sleep, reduced sleep or disturbed sleep. So you should come, if you want a good sleep, you have to come out of medication also, which is very important.
With this, we come to the end of part 3. The third segment, we dealt with the complications of sleep disorders and also the comorbidities that are usually associated with sleep disorders, and most importantly, how sleep disorders can result in the development of comorbidities and how comorbidities can actually result in sleep disorders. Thank you.